Hello, my name is Brandon. I'm one of Dr. Campbell's surgical assistants. I will be guiding you through our post-operative wound care for the surgery you recently had at our office. First and foremost, we're going to want you to take it nice and easy these first couple of days. With your new surgical wound, any strenuous activity, lifting, pushing, pulling, straining, exercise, anything that's going to give you an increased heart rate could cause this to start bleeding or possibly split open. So we want you to take it extra easy. Over the first couple of days, you may wish to ice your surgical wound. Now, it's not necessary, but it does help with bruising and swelling as well as the dull pain that you may be feeling with it. We also ask that you keep your surgical site elevated as much as possible whenever possible. This will aid in increasing circulation and allowing the wound to heal faster. Your wound will consist of 3 layers of bandaging. The first layer are some white steri strips that we would like you to let come off by themselves. We apply some liquid adhesive to help keep them on a little longer, but if you do have absorbable stitches, they are more brittle and are more likely to come off with these strips if you remove them too soon. On top of the steri strips will be a couple pieces of a thin brown paper tape. Lastly, you will have a pressure bandage that consists of a rolled up piece of gauze that will be taped and or wrapped over the wound nice and tight. If your wound is on your extremity, we may wrap it with this cohesive wrap just to keep a little better pressure on it. Your pressure bandage can come off the day after surgery, but if you wish to keep it on for an additional day, you may. When you remove the wrap, it's important to roll it up on itself so that you may use this wrap again. Because it sticks to itself, you can use it over and over again. Once you remove the wrap, you'll remove the remaining gauze and tape. Once your pressure bandage has been removed, you may choose to ice your wound some more. You can get a little better cold contact to the area without that bulky dressing on it. If you choose to ice your wound, we ask that you keep your bag of ice or ice pack wrapped in a towel so as not to get your wound wet. We ask that all surgical wounds remain as dry as possible for the first 48 hours. Other than removing your bandage the day following your surgery, there are no further instructions you have to do for that day. Again, we ask that you take it easy and keep it elevated as much as possible. On day 2 following your surgery, we ask that you remove the thin brown paper tape that are covering up your steri strips. Now, if the strips come off with the tape, that is okay. They weren't sticking that great anyway. You do not have to replace them. Once you have removed the brown tape, we will have you begin your vinegar water soaks. Now, applying your vinegar water soaks. We ask that you mix 1 tablespoon of white vinegar with 2 cups of warm water. Mixing that into a bowl or a glass, you take a washcloth, piece of gauze, paper towel, or cotton ball, dip it into the mixture, and then hold it against the wound. We ask that you do this for 10 minutes, twice a day. If your current gauze tends to run out, you can re-dip as many times as necessary. After you have soaked your wound for 10 minutes, we ask that you apply either some Vaseline or Aquaphor directly over the strips on your wound. Once you've applied the Vaseline or Aquaphor, we ask that you cover your wound with a loose bandage. This may consist of something as simple as a piece of gauze and a piece of tape, a couple small Band-Aids, or a large Band-Aid. You may also reuse the wrap that you got with your pressure dressing at this time as well. We ask that you perform these soaks twice daily. If you have stitches that need to come out, we ask that you do this until you come back to our office to have these stitches removed. If you do not have stitches that need to come out, we ask that you do these soaks for at least 1 week. It is imperative that you use a fresh mixture for each soak. After a couple days doing the vinegar water soaks and a shower or two, your strips may begin to loosen up and peel off. If they do, that is okay. You do not have to replace them. If they're still there when you come back to get your stitches removed, we will take them off then before removing your stitches. After 1 full week's worth of soaks, if your strips have not come off at that point, you may then remove them. It is imperative that you do not develop a scab on your wound. Scabbing takes these wounds much longer to heal, and it also causes your scarring to be worse. If at any point during the soaking process you notice a scab on your wound, we ask that you put an extra soak in around midday. Keep plenty of Vaseline or Aquaphor on it and always keep it covered. By the end of the week's worth of soaks, if you remove your strips and notice you have a scab at that time, we ask that you continue the soaks day to day until the scab is gone. If you have no scabs after a full week of soaks, you're good to go. If you are worried that your wound might be infected, please contact us immediately. The warning signs of infection are redness, inflammation, and pus drainage. If you have any of these, please let us know and we can always get you back in if we need to. You may also have some bleeding from your surgical wound. A little bit of bleeding is normal. Oozing and a little blood on the pressure bandages is normal. Don't be concerned about that. If you develop significant bleeding, we ask that you apply pressure to your wound. When applying pressure, we ask that you pinch the wound from either side as opposed to pressing. When you press down on a wound, your pressure can go down and out and potentially split the wound open. So by pinching the wound, you're actually getting better pressure on the wound and allowing the bleeding to stop easier. We ask that you hold this pressure for a full 10 minutes. Every time you let go to check, you're restarting the clock. Hold pressure for 10 minutes straight. If it's still bleeding after 10 minutes, we ask that you repeat for 15 or either 20 minutes. After 2 rounds of pressure, if you are still bleeding, please call our office. The instruction sheet we provided you with also has our office number and Dr. Campbell's personal cell phone number on it. So please do not hesitate to call if you have any questions or concerns about your wound.